Okay, I chose to do urothelial carcinoma, which is a type of bladder cancer. It accounts for like 90% of all bladder cancers. It's also known as transitional cell carcinoma, TCC. Um, the tissue that's involved in this is the urothelial cells, which usually involves different parts of the urinary tract, such as the part of the kidneys that connect the ureter, the ureters themselves, and the urethra. So it can involve several different areas of the urinary tract. Some of your risk factors are smoking, like workplace exposures, like certain dyes and chemicals and stuff like that. So you've got like painters, people who work at printing shops, hairdressers are a big one. And then another risk factor is arsenic in drinking water. Or not drinking enough fluids can do it too. Usually in the United States, people don't have to worry about their tap water having arsenic in it, but some of your foreign countries that are poverty levels have arsenic found in their water, so they would be at a higher risk. Even though your foreign, less fortunate countries may have arsenic in their drinking water, they aren't as high risk as whites are in the United States. So whites are twice as likely to get urothelial carcinoma than African Americans are. Or if you have an increased age of 55 or more common in men than in women. And some of your statistics that go along with bladder cancer are 80,470 cases of bladder cancer and about 17,670 deaths related to bladder cancer so far. It is the fourth most common cancer among men. Your treatments, we're going to break this down into stages. Stage 1, that's where the cancer is just in the connective tissue and hasn't reached the muscle. It has no muscle involvement yet. And that's usually treated with something called a TURBT, TURBT. It is a transurethral resection. A lot of times they'll use this procedure to test how advanced this cancer has become. And then in stage 2, whereas you have a little bit of muscle involvement, it's also treated with the TURBT and sometimes chemotherapy. Stage 3 gets a little more advanced. It's involving muscle and nearby lymph nodes, or maybe nearby organs. You're going to start out with a TURP on this one. Then you're going to do chemo, and then in most cases a radical cystectomy, which is the removal of the bladder and nearby lymph nodes, usually in that case. Then you have stage 4, where the cancer has reached the abdominal or pelvic wall. It's spread to distant parts of the body. It's usually treated with chemo, with or without radiation. And in most of these cases, surgery is not an option for these folks, because it's spread so far at this point in time that removing the bladder is not going to do you any bit of good. They're just going to treat the cancer at this stage to try and get it to slow down. And just their goal is aimed towards slowing the growth of the cancer at this stage. So your prognosis is, and we're going to work back through the stages on this. So starting at stage 4, you have a 15% chance of survival for 5 years. So that you have a 15% chance of making it to the 5-year mark after you're diagnosed with stage 4. Then moving up to stage 3, you then have a 30% chance to make it to that 5-year mark. 5 years after treatment or diagnosis. Stage 2, you're looking at 77% of a 5-year survival rate or more. So you could live up to 15, 20 more years after you're diagnosed, that initial time in that 77%. Then in your stage 1, you're looking at 65% survival rate for 15 plus years. So even though the 65% is less than the 77%, you're only looking at 77% being in stage 2, 5 years or more. And in stage 1, you're looking at a 65% chance of 15 years or more. So the odds are greater there. To diagnose this, they're going to take a test out of your urine first off, and they're going to check that under a microscope for cancer cells in your urine. Then after that, they're going to do a CT test with contrast dye, which is going to detect abnormal tissues within your bladder, your kidneys, urethra, any of that. It's going to follow that dye on through and going to tell you if you have any abnormal cells in there. Then they might actually do a biopsy of those cells to see like if they're containing cancer cells or not. After the initial diagnosis from your doctor, he's probably going to order an MRI or a PET scan because he's going to want to know what all around that is involved in. So he's going to get an estimate of whether or not that cancer spread, and if it has, how far of an involvement the rest of your organs have and lymph nodes have in this. So nowhere in this did it say any of your signs and symptoms, so I kind of wanted to go over that as well. In stage 1 and 2, typically you're not going to have a whole lot of symptoms involved in this, or if you do, you might just think it's maybe a UTI or something of that nature. Your symptoms are going to be kind of minimal all the way through this. So as the stages progress, you're going to also maybe have some dark urine or some blood in your urine, urine urgency, low back pain, or pelvic pain, which kind of sucks because that's, I mean, you could just think, oh, I have a kidney stone and I need to drink more water, or I have a UTI, so I need to just take some Cipro and get over that and be done with it, when really you're looking at bladder cancer and your doctor is going to go at the UTI and the kidney stone first and not really look for bladder cancer right off the bat, because the symptoms are so minimal with this. So you've really got to pay attention and push your doctor to do more testing involved in this, and not just like scratch it off as a UTI or maybe a kidney stone, or like a minute bacterial infection or a yeast infection for that matter. It can cause some of the same symptoms in women. So you really want to keep a heads up on that sort of thing. That's all I got for you. Thanks.